Hi everyone, I'm Dr. Mathangi, a senior consultant cancer specialist working at Gleneagles Hospital, Bengaluru. Today we are going to talk about a very important topic, a cancer that can be completely prevented and if detected early can be completely cured. Do you really believe that? Please listen to us.
What is this cancer and where does it come from, doctor?
This cancer, what we call it as preventable cancer, is basically a carcinoma or a cancer of cervix. Where is cervix? Cervix is the lowermost portion of the uterus. If you see that this is the uterus, your tubes and your ovaries, the lowermost portion is called the cervix. To very simply understand what a cervix is, when a baby comes out, this is the portion that opens up to deliver the baby outside, or otherwise it holds the baby for the entire 9 months before coming out. So this is the strongest portion of any female reproductive system.
Doctor, is this cancer a really burden to the country?
A very big burden to the country. Thanks for this question. A very big burden. Why? Because even if there are 6 lakh patients diagnosed, more than 3.5 lakhs are dying, which means more than 50% women are dying of this cancer. It is not about having cancer, it is about dying with cancer. And the second point is this cancer very importantly affects the younger age women. Right from 20 to 44 years is the peak of incidence, and later it may even affect till 60 to 70 years. But imagine a 30-year-old lady having few children, then managing their family, having this cancer and dying because of this cancer. And the third most important point is, if there are people dying in all over the world, India contributes to more than 30% of the death from this cancer. And last important point is, remember, every 8 minutes, one woman from India is dying of this cancer. Is it not a burden to our community?
Doctor, how do we know we have got this cancer and what are the symptoms and when to see the doctor?
Very good question, sir. So the cancer is forming at the edge of the cervix. So you know that is the lowermost portion. So at the edge of cervix, if there is a cancer or some friable growth which is going to sit there or unhealthy tissue, any lady will immediately have stains of blood or small bleeding or spotting immediately after the sexual intercourse. That is the first and foremost alarming sign. Second thing is, you may have bleeding between your periods or increased bleeding during your periods. Second point. Third point, even if you have achieved menopause, this lesion here will cause spotting or bleeding. So any bleeding after your sex or between your periods or too much bleeding during your periods or after menopause, that is very, very dangerous. Any spotting or bleeding after your menopause is always dangerous. You have to check it out. And the most important thing, if there is a huge growth sitting here, mild watery discharge will always be there. The patient will be complaining, I'm having white discharge, sometimes streaks with blood. And after this, if it is growing more and more, it's going to pull down. So you may have lower abdominal pain or back pain, or sometimes even advanced, they may have swelling, what we call it as edema, swelling of both the lower limbs or even one lower limb. We always suspect carcinoma of the cervix.
And what is the real cause of cancer and its risk factors, doctor?
Very interesting question, sir. This is the cancer which is caused by a virus. Can you believe that? So this is one of the cancers other than our hepatitis B causing cancers. This is HPV, human papilloma virus, which causes the 95% of the cancers in the carcinoma of cervix. But what does a human papilloma virus is normal and it is present in every human being. It is a normal variant and it has numerous variants. And why this virus is causing cancers? When you have a longer sexual life, like for example, you have a very, very early marriage, or you start your sexual life even at your teenage years. So definitely marriage is not an indication for sexual life. So the age when you start your sexual life and a longer period of sexual life, like from 15 to 55, everything. So the exposure of HPV increases and the HPV starts growing and becomes dangerous whenever your immunity goes down. How does your immunity goes down? When you have smoking, it can be either first hand, I smoke or you smoke. It can be also second hand smoking. And then the most important thing is when you take your oral contraceptive pills, they say the immunity in your cervix goes down and the human papillomavirus thrives. Of course, other immunosuppressions are, lot of infections, bacterial infection when it happens also can help the virus into propagate. And the most important thing, when you have multiple sexual partners, obviously the chance of you getting a HPV virus increases. So the other most important thing, if you have hepatitis B or HIV, wherever again the immunity goes down, the human papillomavirus thrives and stays there and it changes you into a cancerous growth.
Doctor, can this cancer be really prevented, and how can it be prevented?
Nice question, sir. That is the topic we are talking about today. It can be completely prevented. How? The HPV virus, once it enters, it slowly changes the cells from mild dysplasia to mild to severe dysplasia, and then it becomes precancerous and then it becomes cancer. Believe me, it takes 10 to 15 years for this infection to this cancer. You have 10 to 15 golden years to check yourself if you have any changes. Even if there are small changes, if you treat them, obviously you're not going to get cancers. How do we check for this? We do called a pap smear. This was invented by George Papanicolaou in 1928. In developed countries, people are having screening for past 100 years and we are still coming to get to know the name called pap smear. Little advanced version is called liquid-based cytology. You just put a brush in the cervix, collect the cells, put it on a slide, check in the microscope. If the cells have changed or showing even smaller changes, get treated. You are not going to develop cancer. So that is called pap smear or liquid-based cytology. Sometimes you can also get co-testing, like you get pap smear also and check for HPV DNA. It should always be co-testing. But if you check for HPV DNA, you can do it once in 5 years. So pap smear, at least, even if you are not getting yearly, at least get it once in 3 years.
We started, and how frequently we have to screen?
So that's a very good question, sir. So we know that a pap smear should be done. But when should we start this test? According to guidelines, you are supposed to start at 21 years. But we know that HPV virus enters through sexual life. So only when a sexual life starts, that is the age. So you have to give at least 3 years buffering time for a HPV DNA infection to become established. Because HPV infection is self-limiting. Sometimes it will go away by itself. So we give minimum 3 years for any changes to happen. So you know your age when the sexual life started. Please start your screening 3 years after. The guideline says you have to do your test yearly once, and after 3 tests, if it becomes negative, you can do your test once in 3 years. But at least WHO requests you, even if you are 30, get it at least once in 3 years. If you do HPV DNA co-testing, we recommend you to have a testing at least once in 5 years. It's just a 5-minute test, putting a brush and just putting it on the slides. Not painful, not at all embarrassing, because it is saving your life, some danger word called cancer. So a 5-minute pap smear test starting at the age of 30, once in 3 years. You can stop at the age of 65 or 70, but please start it as early as possible.
Doctor, can something be done to the children so that they don't develop this cancer in adult age, adult life? Doctor?
Very good question, sir. So we talked about prevention in adults, once before the sexual life started or after the sexual life started. Now children, can we do something at that life, even before the sexual life started? Can we do something? Yes. We know if there is a virus, we can create a vaccine. Our COVID times have taught us that. So the vaccine has been created against HPV virus. If that has been put for children before the start of sexual life, they get antibodies when they start their sexual life that protects them from long-term HPV infection and protects them from getting any cancer. But again, the hitch is, you are vaccinated against COVID, but still you can get COVID infection because the virus on any day has multiple phases, multiple variants. The vaccine has either 16, 18, 31, 32, 45, like that, 9 variants in it and can protect you 90 to 95% from cancer, but still it cannot protect you 100%. They always say even if you're creating 9 variants, even another variant comes, this will have a cross immunity and still protect you. So vaccination, even if you get it done, still you have to continue your pap smear at the age of 30. In simple words, if you are 13, before you start your sexual life, around your teenage, get vaccinated. But if you have started your sexual life, you are around 30 years, please start your pap smear.
Doctor, is it a hereditary or?
Good question, sir. Very good question. Because it is caused by environmental factors like a HPV virus, obviously I'm not getting it from my mother. But still studies are going on. Do I have a susceptibility, genetic susceptibility that this lady also had HPV, I also had HPV, but mine got into cancer. She did not get cancer. There may be, but still studies are going on. Until then, we are not sure, and definitely till date, evidence are not there that it is hereditary. I don't get it from anybody else. I get from my infection and my risk factors.
But
yes,
any chances are there?
No, sir.
No.
Till now, there are no evidence. No.
Any age limits to develop this sort of cancer, doctor?
Age limits, yes, sir. It can start even from the age of 20 and it goes on till 60 to 70 to 80, any age. But it depends on how protecting you are, how screening you are, and how much you are vaccinated.
Apart from the medication, how much this mindset acts on the patient's this?
Very good question, sir. So, you were asking me a question. So, pap smear is being done. People are vaccinated 20 years even before, and studies are happening on vaccinated women in US and UK and Australia. We don't even know about pap smear. We don't even know about vaccination. That is our situation, our society. And the second thing is, in spite of doctors going and crying out, please get a pap smear done, when they come for master health checkup, we feel embarrassed to getting this test done. That is the most important factor that the doctor is fighting out. Please come and get tested. It is here. We are ready to test, but the lady is not ready. So please put out your inhibition. Have that. It's only a simple test, 5-minute test. I'm going to get it done. Number one, your mental makeup is very, very important. Second mental makeup is always be thanked. I don't want to get tested because it will not happen to me. This is the attitude that prevents you from taking any test, and you come for treatment rather than for prevention to a doctor when something goes wrong. And the most important thing, even if you get this cancer, believe me, if you are in early stages, if you are getting treated at the right time and by the right person, you are cured for your lifetime. That this is the only cancer which can be completely cured if you come at the early stages. So the mental makeup, and the last important thing, the willpower and the positive mental makeup. Yes, I'm going to get screened. Yes, I'm going to give attention to my health. And yes, it is easy to take treatment. That will help you have a very, very healthy and happy life.
And one personal question for you, madam.
Yes, sir.
What kind of patients you have you have undergone to treat the cancer, doctor? Most toughest.
Very good
patients.
question, sir. One of the ladies which has never gone out of my mind is, she just delivered a baby and she came to me. She had already stage 3 cancer. Along with, she has never gone for a checkup, even during her maternity time. She's never gone for a checkup, and she went as an emergency for a cesarean section. And during cesarean section, they found out when they're cutting, the cancer spread along with the searches and it spread everywhere. Can you believe she has never got tested? Just even seeing a cervix, that even was not done, though she was pregnant for the second delivery. This is what is the pathetic situation. Though we could save her, we could treat her, but this could have been completely prevented. It always sits in my mind when we see huge growths and it is infiltrating, eroding the bladder, and the people are leaking out urine. And there was a lady who was bleeding and she was continuously urinating and smelling of urine, deserted in my OPD by her own son. But these people could have taken her for one pap smear or at least for a treatment at the right time. These things still sit in my heart, and that is what is pushing me out of my OPD to not just treat patients but also create awareness that it could have been prevented.
And one more thing, doctor.
Yes.
At what stage this cancer can be cured?
Very good question, sir. I said already it's a curable disease. Yes. If for stage 1 and 2 you have 90 to 95% chance of getting completely cured. And the moment it becomes stage 3, you still have 50 to 75% of getting completely cured. I'm talking about cure. Cure means it is not coming back. Some few patients, even of stage 4, we have tried our best to keep the disease under control. So any stage, just don't worry, just come for treatment.
Any advice to our viewers, doctor?
Sir, I have told, we women are very, very strong and are the basis of a family. But we forget that we have to take care of us also. The moment every time I finish my awareness talk, every mother is ready to bring their girl for a vaccination, but forgets that she has to have a pap smear. If a mother is not healthy, she cannot take care of her family. So please take care of your health, be strong, stay healthy so that you can take care of your family. So the first step is please come for a pap smear, just at least once in 3 years. Thank you.
One more thing, is it a contagious cancer?
That's a very good question, asking whether cancer is contagious. Every person thinks the moment cancer it is there, even my lung cancer patient, the moment they cough, the attender says because he is coughing that lung cancer will come to me. Definitely not. Cancer is something because of the irritant, some irritant stimulation. For example, in lung cancer you have smoke that is irritating and causing the growth of cells. Here the HPV virus is just irritating and causing the growth of the cells to happen as a tumor or a cancer. So the HPV virus comes because of a sexually transmitted diseases. But cancer, once it happens, again it is not contagious and goes to somebody else. So they need not be separated and they are not spreading cancers. Thank you. Yesterday was a very, very important day for all girls. It was celebrated as a National Girls' Day. Can we take a step forward on this? Like our hospital launched a campaign against cervical cancer and are inviting every girl child to come to our hospital and get vaccinated, and we are going to create awareness in every school, college, hospital, corporates, apartments, everywhere to just create awareness. Please go and get your pap smear done, or please, any day we are ready to create awareness. But from your side, when are you going to take responsibility for your own health? There is a difference. If mothers are not coming, daughters can bring their mothers and can take care of mothers' health. So let us grow up. Being a strong girl, we can be responsible for our mother's health. Pushing them to get a pap smear when you get vaccinated. Thank you.